Today I want to talk about the 3 most important exercises to avoid following a breast surgery and the reasons why. My name is Lisa Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to keep us all lymph smart. Now, following any breast surgery or reconstruction, it's my experience that many patients present in a very forward bent and protective posture because their chest area is in pain. But as you can see, this posture brings our head, neck, and shoulders forward. It internally rotates our shoulder, and we typically sit with our arm and our elbow in this bent position. Now, all of these together create a significant amount of tightness in our chest wall or our pectoral muscles, as well as in our bicep muscle. And we want to do everything in our power to stop overworking those muscles, to stretch them out, but most importantly, we don't want to do anything that could potentially disrupt or harm the surgery itself. So if the doctor is creating a pocket for an implant or a tissue expander or many other things that involve a lot of work on the chest wall and breast area itself, we want to avoid these 3 particular exercises and motions. Number 1 is a plank. And a plank is something you're probably going to have to avoid for about 6 months, give or take. And of course, it's your own medical team and usually your plastic surgeon or reconstruction surgeon who's going to be giving you the A-OK to move forward. But anytime you're in a plank position, whether it's a regular or traditional plank or a modified plank on your knees or even on your elbows, you're still doing a lot of excessive pressure onto the chest wall and pectoral muscles themselves. So that's the reason you really want to avoid any planks for a significant amount of time following your breast surgery. The second exercise to avoid is bicep curls. Because the bicep muscle is already tight and short, we don't want to do anything that is going to further tighten that muscle, and any exercise that's going to focus on strengthening the bicep will further tighten it at this time. So stretching of the bicep muscle is going to be very important, but any exercise that isolates the bicep muscle in a strengthening position should be avoided at this time. And the third and one of the most important exercise to avoid is anything that is repetitive in an overhead range of motion. So if we consider 90 degrees functional, anything that is repetitive over 90 degrees should be avoided at this time, no matter what plane of motion you are moving in, and specifically with Pilates reformer exercises. Now, I love Pilates and I love the reformer, but as you can see, when you're laying down on the Pilates reformer and you're grabbing the handles, sometimes just pulling the handles up and doing work overhead with the resistance can cause more problems. So have your therapist or trainer or Pilates instructor hand you the handles at 90 degrees and feel free to do work below this 90-degree plane, whatever it is. Now, as always, it is only your own medical team who can remove these restrictions when appropriate. It's typical for these restrictions to remain in place for about 6 months, give or take. But again, it is your own medical team and specifically your plastic surgeon who is going to recommend the safest and most effective plan for you as you move forward to ensure that you don't cause any extra pain or damage to your surgical site. I hope this information has been helpful. Please like, share, and subscribe to stay informed and to remain lymph smart.